Mental health care workers with Kaiser Permanente are on strike for the third day. We first brought you this news on Monday when the strike started, and tonight we are diving deeper to get you more answers. Now, more than 2,000 mental health therapists, social workers, psychologists, and chemical dependency counselors are on strike. They've been picketing at 8 Kaiser facilities throughout Northern California and the Central Valley, and they say they are understaffed and overworked and that patients are suffering as a result. Our lead reporter, Becca Habegger, has been looking into this. And Becca, break this all down.
Yeah, well, first of all, we have to look at this at a nationwide level, way beyond Kaiser Permanente. There is a mental health care worker shortage. And one local mental health public policy advocate says that here in California, 1 of 3 people living with a mental illness is not getting the care they need. And of all our counties, 31 of them say they have both a mental health care worker shortage and a high need for them. But here are some possible solutions.
One is increasing the diversity of the workforce so that people can get culturally competent care that they need, addressing issues of recruitment and retention, addressing issues of pay, creating career ladders for people in the workforce so that they're supported into the long term.
And this was a problem before COVID.
Oh, yeah, absolutely. But COVID and now economic pressures are definitely increasing the demand for mental health care for people. We spoke with a Kaiser Permanente psychologist who says he and other providers are striking this week specifically because their union and Kaiser Permanente can't come to an agreement on how many hours per week these providers should be able to spend on what they call indirect patient care,
which is when we receive emails and phone calls and do charting. The employer describes it as quote unquote administrative time. It is not administrative time. It is patient care time. That isn't always face to face, but it is definitely for patient interests.
For example, he says with COVID, he's seeing more emails come in every day from patients with questions. Those take his time and effort to respond to.
And what is Kaiser saying about all of this?
Yeah, well, Kaiser wants providers to spend as much time as possible with patients. For example, they say currently a therapist is allotted 6 hours per week for work outside of direct patient care. The union wants 9 hours per week. Kaiser Permanente has countered with 7.2 hours, and this strike will continue until those two groups can arrive at the same number.
And what about patients during this strike? Where does this really leave them that are still needing those services?
Yeah, for sure. This is where patients are caught in the middle of this strike. We spoke with Kaiser Permanente today. They say that as of yesterday, some 1,600 follow-up therapy appointments had to be canceled. They are reaching out to every person who is affected, who has this cancellation, and they say care is available if it's needed. But they say we are grateful that several hundred of our therapists are choosing to continue to deliver care to our patients, rejecting the call by union leaders to walk away from people who need help. So in summary, the strike will continue until Kaiser Permanente and the union can agree on how many hours per week these clinicians should be allowed to do work outside of direct patient care.
All right, Becca, thank you. We appreciate it.